Assalamualaikum and good morning, madam. Today I will be presenting my qualitative study titled Training Load of Newly Recruited Nurses in Grade A Tertiary Hospital in Shanghai, China. This presentation discusses the challenges faced by newly hired nurses due to the intensive training system, the impacts of training overload, and recommendation for improvement based on cognitive load theory. So, we will start with introduction first. For this introduction, I will explain the background of the study. In Shanghai, Grade A Tertiary Hospital, newly recruited nurses are required to undergo strict and standardized training programs. The purpose of this training is to ensure that nurses quickly achieve clinical competence and are able to meet hospital standards. However, the training is very demanding. Nurses must attend long and frequent training sessions while simultaneously managing heavy clinical responsibility. As a result, many new nurses experience training fatigue, cognitive overload, and emotional stress. In addition, the rapid advance of modern healthcare system and increasing participant expectation place extra pressure on nurses to perform well from the very beginning of their careers. They are expected to master not only technical skills but also clinical reasoning, hospital protocols, emergency procedures, communication skills, and legal policy within a short period of time. So, this situation raised concern about whether the current training system is effective, sustainable, and supportive of nurses' well-being. Okay, so next I will explain about the purpose of the study. The purpose of this study is to explore and understand the different types of training overload experienced by newly recruited nurses. Okay, specifically, the study focuses on three forms of overload. The first one is internal overload, which relates to the complexity and volume of training content. Second is external overload, which refers to training format, scheduling, and frequency. As is physical and mental overload, including stress, fatigue, and work-life imbalance. So, in addition, this study aims to examine how this overload affects training effectiveness, job performance, emotional health, and long-term retention of nurses. Finally, the study proposed improvement to the training system using cognitive load theory as a guiding framework. Next is about methodology. Okay, this study adopted a qualitative research approach. 15 newly recruited nurses from 3 different grade A tertiary hospitals participated in this study. Data was collected through semi-structured, face-to-face interview, each lasting between 40 to 60 minutes. Okay, so the interview focused on the nurses' training experience, emotion, challenges, and personal perspective. After data collection, thematic analysis was used to identify recurring patterns and key themes across participants' responses. So, these methods allow for an in-depth understanding of nurses' real experiences with training overload. Okay, so next is about overview of main findings. The finding reveal 3 major categories of training overload. First is external cognitive overload, which is caused by high training frequency, repetitive content, and poorly structured training schedules. Second is internal cognitive overload, which results from overly complex and heavy content that does not match nurses' educational backgrounds of learning pace. And the last one is physical and mental overload, which includes exhaustion, stress, lack of sleep, anxiety, and disruption to personal life. So, these 3 forms of overload interact with one another, creating a continuous cycle of stress that reduces learning effectiveness and overall job performance. Now, I will talk about external cognitive overload. Okay, external cognitive overload refers to the burden caused by how training is delivered. Okay, according to the nurses, training sessions were mostly lecture-based and relying heavily on PowerPoint slides. So, these sessions were described as boring, passive, and lacking interaction or feedback. Additionally, training schedules were often poorly organized. Okay, so sessions frequently took place during rest day, after night shift, and or alongside already heavy workloads. So the high frequency of training session, sometimes several times per month, and further contributed to mental fatigue and reduced motivation. Other than that, we have internal cognitive overload, which occurs when training content is too complex and too fast-paced or too dense. So, nurses reported being expected to master emergency procedures, hospital policies, theoretical knowledge, practical skills, and examination material within a short time frame. This caused confusion, frustration, and reduced confidence, especially when the difficulty level did not match individual educational backgrounds. The large volume of information delivered in brief sessions exceed nurses' working memory capacity and making it difficult to retain and apply knowledge effectively. Okay, so the last one is physical and mental overload was evident through symptoms such as exhaustion, lack of sleep, stress, anxiety, and emotional fatigue. Many nurses reported exam anxiety, lack of personal time, reduced enthusiasm, and limited opportunities for rest of social life. The constant pressure to attend training, study, and perform well led to burnout and decreased job satisfaction. So, over time, this negatively affected nurses' emotional well-being and commitment to their profession. Okay, so now here I will explain about the advantages of standardized training. Despite these challenges, standardized training does offer several important benefits. It ensures consistent clinical knowledge among all new nurses and supports patients safely through structured skill development. Next, standardized training is also help nurses adapt more quickly to workplace demands and builds essential competencies for emergency and critical situations. Furthermore, exposure to different departments enhances professionalism and broadens clinical experience. However, these advantages can only be achieved if training is well-paced, well-structured, and learn-centered. Okay, besides that, we also have disadvantages of current training system. The current training system also presents several disadvantages, which is high training frequency leads to fatigue and burnout. Training conducted during rest periods disrupts sleep and affect mental health. Other than that, overly theoretical content reduces practical relevance, while poor scheduling limits recovery time. As a result, training is often perceived as a burden rather than a learning opportunity, and repetitive exam-focused sessions increase anxiety among nurses. Okay, now the explanation about challenges faced by new nurses. Okay, new nurses face multiple challenges simultaneously, so they must adjust to new professional roles while attending intensive training, balance clinical duties with exam and assignment, manage long working hours, and cope with emotional stress. At the same time, they are under pressure to avoid errors, meet high performance expectations, and function effectively in fast-paced hospital environments. So, maintaining a personal life under this condition becomes extremely difficult. Okay, now I will explain about the implication of training overloads. Okay, did you know that there is a serious implication in if we get training overloads? Okay, so the implication is it reduces learning outcomes and training effectiveness, increase emotional exhaustion, and negatively affects job performance. In the long term, it contributes to burnout, lower engagement, teamwork difficulties, and higher staff turnover. So, this also poses risk to patients' safety and causes hospital to lose newly trained nurses, leading to increased recruitment and training costs. Last but not least, it's about recommendation. To address this issue, the study recommends redesigning training programs using cognitive load theory. This includes reducing training frequency, improving scheduling, and adopting flexible learning methods such as online modules, simulation, and microlearning. Training content should be streamlined, unnecessary repetition avoided, and focus placed on essential clinical skills. In addition, hospitals should provide mentorship, emotional support, balanced workloads, and flexible learning opportunities to support nurses' well-being. Okay, so now we have reached the end. In conclusion, although training is intended to enhance nurses' competence, excessive content, poor structure, and high frequency have the opposite effect. New nurses become physically and mentally exhausted, leading to reduced job satisfaction, weak knowledge retention, and lower engagement. The finding highlights the urgent need to redesign training system to ensure effectiveness while protecting nurses' well-being.